We really need to make a system that's simple, intuitive, and meeting patients where they are at the end of the day. Anytime you get into re-educating you're talking about educating patients on how to use the system. The system should be designed around their current behaviors versus trying to get them to change their behaviors in order to receive care.
New choices, new players, new models of care. You know consumer first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go.
Welcome back to the leading podcast about consumer-centered healthcare. This is episode 351. I'm Jared Johnson, and here's what's going to go down today. We have the Flava of the week about what Rock Health is saying about wearables. What can we learn from their data about wearable usage? And how can we remember mature technologies as we design and build consumer-centered services? I'll talk about that. Then Darren Sabo, the CEO of Primefocus Health, joins us to give an inside look at the company's launch in partnership with LG. He covers a lot of ground about health at home and educating consumers on this quickly evolving space. It's time to dive right in. Are you ready? Let's go.
Flava of the week.
Wearables are a mature market, but their pervasiveness continues to give them a foothold on consumer health. A substantial number of Americans continue to own wearable health tracking devices such as smartwatches or smart rings, 44% according to an article by Rock Health on August 4th. The post pointed to a study published earlier this year in the Journal of Medical Internet Research that analyzed the ownership and usage of wearables among 24,000 U.S. respondents. Some of the top-line takeaways weren't any surprise at all. The data confirmed that we see more wearables among people who are younger, more affluent, more educated, more urban, and have private or employer-sponsored insurance. You have to dig through the study a bit, but the findings give some consumer insights that can inform healthcare services. Number one, when asked how they acquired a wearable device, 3 out of 5 respondents said they purchased it themselves, and about 1 in 5 said it was a gift. Only 8% said it was offered by their clinician, and only 3% said it was offered by their insurance company. The lesson is that reliance on direct-to-consumer channels for acquiring wearables underscores the discretionary nature of wearable purchases, and it signals a possible relationship between health consciousness and wearable ownership. Number 2, the most popular health-related uses of wearables continue to be proactive health activities, including increasing physical activity, fitness training, losing weight, sleeping better, managing a chronic condition, and finally, managing stress. And number 3, as wearables are considered for clinical care and public health surveillance applications such as communicable respiratory and infectious diseases, it'll be critical to continue to track ownership patterns and address biases in the wearable user population related to age, income, education, and area of residence. These insights can help us build consumer-centered service lines. While we're easily a decade removed from peak hype about wearables, I can't get over the figure that 44% still own one, and 3 out of 5 bought it themselves. In other words, millions of people have them and use them. And that tells me that people would rather be well than needing care. So I'm not going to focus on all the reasons why they haven't caught on even more. Remember, if you know me, you know my point of view isn't to make excuses about why the status quo exists. It's to think about what's possible, what a different future could look like, and what it will take to get us there. Let's remember wearables and other mature consumer health technologies as we design and build consumer-centered health together. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week.
The flow.
All right, everyone, let's get into the flow. Give it up for Darren Sabo, please. Darren is the CEO of Primefocus Health. Welcome to the Healthcare Wrap, Darren.
Thanks, Jared. Thanks, Zane.
Zane, what are you hoping to hear in today's interview before we get going?
Good question. Well, last time we chatted with LG, we knew they were making some additional investments in digital health. And so I think I'll be just excited to kind of get an update on that and see overall where they're going. And then more specifically, what is it that Primefocus Health is bringing to the market and how they're serving health consumers.
Perfect. Well, a great intro then for Darren to be able to introduce yourself and tell us a little bit about who you are personally and professionally. Let's start there.
Excellent. Thanks a lot. So my name is Darren Sabo. I'm CEO of Primefocus Health. Primefocus Health is the first new venture spin out from LG Nova, which is a North America Innovation Center for LG Electronics. We're focused on home health and providing a better experience for both patients and providers as patients transition home following a acute event or to help manage longer-term chronic conditions. And this ties back to LG's broader vision of providing a better healthcare experience to help people live better lives.
Love that. What about personally? What would you like our listeners to know about you?
Personally, my career has been a bit of a winding path. I actually started off as an archaeologist, if you could believe that, early in my career.
No way. That's so cool. That is so cool.
And then quickly realized it was very difficult to make a living as an archaeologist. And that was kind of a rough life, digging out in the dirt and in the rain and such. So I pivoted my career into market research and understanding consumer trends and behavioral patterns and doing new product development for another Korean company, Samsung Electronics. And I was there at a really interesting period in time when it considered related to consumer electronics. It was the development of the first flat panel TVs, the development and launch of HGTV, all these technologies that are now just commonplace in consumers' homes. We were just launching and figuring out how to position that in the market. And it was really interesting transition from the field to more of a corporate environment. And then after that, I got involved in startups, and the future is just kind of wrote itself.
Well, I guess there's some similarities between, archaeology and the discovery of it all and, kind of what you're doing today and what you have done in research with Samsung and now over to LG. So I can see the connection, I suppose.
There's an excitement about being the first to do something.
Yeah, well, I think it's wonderful too. You have that international experience and then work for large companies that are multinational, which me being the Canadian, I think one of the contributions I was supposed to make on this podcast is pull more Canadians into the mix. I don't know if I've been super successful, but just being able to see from different lenses how other health systems organize and how they think, I'm sure you would attest that they're totally different. And maybe other anecdote I'll show out there. We've had Zipline on the show once, and as probably know, they did a lot of their pilot work in Rwanda and are doing wonderful stuff now here in the U.S. And so I could see why you're in the role that you're in, given the broad set of skill sets that you bring to the table, including being an archaeologist, which I'm still wrestling with. That's pretty awesome.
I know the folks over at Zipline. We had a number of talks with them when I was in telecommunications. I think that's a great example of providing access to care in environments that lack the underlying infrastructure to deliver traditional forms of care.
Well, let's talk about it. I know you briefly shared what you all do at Primefocus, but would love to understand a little bit more. What are the solutions that you all are bringing to market? What problems are you trying to solve? How did Primefocus even get initiated? Would love to hear sort of the founding need and story that got you to where you're at today.
Absolutely. So we took a bit of a different approach with the formation of Primefocus. And actually, this speaks to the broader vision of LG Nova and the whole premise of using more of an outside-in methodology versus the traditional R&D methodology that corporates typically follow when they develop new products and services. A lot of times when you take more, or not to criticize that approach, I think there's certain situations where more of a longer term R&D approach makes a lot of sense. But when you're really trying to adapt quickly to the needs of the market, sometimes it's much quicker to just see what's out there already, see who's doing what, and really learn from an ecosystem of partners that have been boots on the ground with patients and providers for years, and learning how you could help either accelerate their growth or expand their capabilities to something that leads to a calculus that's really 1 + 1 = 3, or you can really multiply the impact of what they're doing. And that's the latter is the approach that we're taking. So when LG Nova was formed, it was formed under the premise of going out, reaching out to the best and brightest startups and early technology companies across a couple key verticals, healthcare being one of those, and really understanding from them what are some of the gaps that they're seeing in the market. And there were obviously lots of ideas that we vetted. I mean, dozens and dozens of proposals and ideas. And one concept was the idea that home health care and remote access to care is pretty fragmented right now. There's a variety of point solutions in the market, but when it comes to the experience of both the patients and the provider in delivering care at home, it could be a very fragmented and confusing experience all around. I think there's a number of reasons for this. One, as you said, Zane, things are just very different in different health systems. They do things differently. Their clinical pathways are different. How they access their patients they've developed it very regionally. Another thing was just, following the pandemic and the rise of the telehealth waivers and a lot of investment that went into digital health and remote health solutions, I think it created a lot of frothiness in the market. So you had a lot of different solutions providers providing a variety of tools or therapies to deliver to patients at home, but there was no way to really connect those experiences. So that onus was really put on the provider. So the providers they have all these technologies that are coming to them, all these point solutions. And now all of a sudden they're saying like, okay, I have a patient with chronic heart failure, or I have a patient managing diabetes or chronic obesity. How do I put together an experience that's going to help that patient? And they wound up being put in this position where they had to be the technology providers themselves. So that fell on the CTO, the CIO. They had to ramp up their engineering teams. And that's not their best, where they add the most value, let's just say, in the whole value chain of healthcare, providing healthcare. But they were backed into this position. I think, there were a number of challenges that led to some increased cost to deliver the care, because now they had to be the solutions integrators, let's just say, themselves. I think it led to a lot of confusion for the patients in terms of having a variety of apps now that you have to manage in order to manage your care. So with that said, we saw an opportunity to create a digital health platform that brought a lot of these solutions together in a more unified fashion to address more specific clinical conditions for the provider as well as the patient. So what does that look like? If you think of remote care, typically the mind goes to RPM, right? Remote patient monitoring. So it's not a great experience in general. Some providers, I think, do a much better experience than others. I got to see this firsthand with my parents. I was helping manage care for two parents in their mid to late 80s. And their RPM solution was essentially just to send them home with boxes of devices that they were supposed to learn how to use and learn how to connect. And that was the solution to keeping track of their vitals over the course of time and maintain that communication feedback to their care providers. Obviously, after a week or two, what do you think happened? They stopped using them. Either they ran out of battery life, or they didn't know how to get the data out of them or pair it to something. And that whole experience was broken. And then there was obviously no communication back to the care provider in terms of what their current state of health was. We're working with solutions providers that try to simplify and streamline the process of not just RPM, but also remote therapy delivery. So once we're collecting the vitals and we're gauging the progress of the patient, what do you do with that information? How do you deliver therapies that could be effective in improving their state of recovery instead of just adding extra data points to a physician's already just...
What would be some examples of therapies that you all are seeking to deliver through your platform?
Remote physical therapy, that's one of them, and integration of, let's say, VR and AR into physical therapies. I think that's a great use of telemedicine deployment and remote therapy deployment. One of the other technology providers that we're looking to integrate is providing contactless vitals capture. that story I told earlier about my parents that had like a box of different devices to monitor their heart rate, blood pressure, SpO2, so on and so forth. What if you could do that in a way that was minimally invasive and more passive? So we're working with a number of providers that are exploring what's called RPPG technologies. I don't know if you're familiar with this, remote photoplethysmography.
Tell us about it.
So it's essentially taking an RGB feed, so a video feed, and converting that video feed into vital signals.
Really?
It's pretty cool. I was very skeptical at first in terms of the accuracy of the data collection, but it's actually really good for heart rate. We're seeing really good data for blood pressure as well. And there are a number of other vitals you could potentially capture. But if you think of at a high level, foundationally, it's if you have a smartwatch, uses photoplethysmography to collect your vital signs. So it's essentially taking an RGB signal, so the video signal, and doing some technological wizardry to convert that to a PPG signal, which is, more in line with what you're familiar with, wearable devices. Interesting technology, but it just goes to show you, we're looking at ways to simplify the process. And these are just a couple of examples of how we simplify the process. Another technology we're looking at is ways of taking your discharge instructions and making that as simple to digest as possible for the patient. So instead of being sent home with a 25-page PDF of what you're supposed to do following discharge from a surgery, right? How do we take that and use AI to convert that into an easy to digest video or some sort of FAQ or Q&A that the patient could easily digest and really understand what the expectations are for them over the course of the next week or two following discharge.
That's fantastic. So typically then who would be your customers? Are you looking to partner with like health systems to enable this?
Providers?
Okay.
Yeah. We're working directly. Exactly. So we're working directly with providers to understand their needs and the care pathways for specific conditions, let's just say, and understand how we could create a better unified experience to support remote patient needs.
And then how are you all thinking about, sorry for the rapid fire questions, but how do you all think about the, call it the provider experience? So one thing we've heard loud and clear on the podcast here with anyone in the home care space or remote patient monitoring space, the providers are inundated with data. And so curious, how do you all think about, or what are you doing to surface the right data or flag the provider when a patient actually needs some level of intervention versus, hey, just sending them, this is Darren's heart rate today, but it doesn't really need any intervention. So how do you all think about that in managing the provider experience?
Yeah, absolutely. So when we talk to providers, again, depending on the provider, sometimes we get some conflicting insights here. And in terms of like providers will tell us, okay, we want everything piped into our EHR. We don't want you to have any access to our data. We want complete control and ownership of our data, and the data needs to, reside in our EHR, and you can't do anything with it. But at the same time, they'll say, how do we make sense of this? How do we get insights out of this data? How do we know what to do with it? Which requires us to have access to the data to run analytics on that or to uncover certain patterns with what's going on with the patient to flag that for the provider. So the way we're looking at it right now is really asking the providers, what are the key metrics that you're looking for, and how do we get you just those key metrics? A lot of times it's not the heart rate that they're looking at, it's the variance or it's the longitudinal data that they're really concerned with. They're looking for the patterns. So it really comes down to how do we push you insights in terms of the patterns over time versus a real-time feed of that data. Does that make sense?
Totally.
And physicians don't know what to do with all that data either. You give them more data points, they're not exactly sure how to interpret all that new information that you're now pushing to them.
we're still pretty early on overall with home health. We're still early days, even though the practice and the technology has been around for decades. We're still learning how it works. Like we're still learning how to do it effectively. We're still learning how to, at the end of the day, make care better for somebody in the home. We talk a lot about how most people wouldn't choose to go to a hospital if they could choose to stay in their home. They'd rather do that. It's more comfortable, if you could have the same quality of care. So, that's always the question is, do we have to educate people, I guess, on how it works? All that to say, what's the vision for helping consumers engage in their health in the ways you were talking about?
So we really need to make that simple, intuitive, and meeting patients where they are at the end of the day. Anytime you get into re-educating you're talking about educating patients on how to use the system. The system should be designed around their current behaviors versus trying to get them to change their behaviors in order to receive care. We've seen this in other markets. It's not like we're able to do this in e-commerce, social media, and other ways of engaging with consumers to get their attention and get them, I want to say, let's just say highly engaged in these solutions. But when it comes to healthcare, all of a sudden we expect them to change their behaviors to fit a very specific model just because it's easier for us. And I think that mindset needs to shift. And I think we need to really better understand what consumers are doing and meeting them where they're at instead of expecting them to change to meet us where we are. And that also involves including, taking a more holistic approach and involving their caretakers, the community, family members that are involved in their healthcare. So it's not such a, individual experience, because in reality, healthcare isn't, especially when you're managing a chronic condition, you have a support network, right? So what's the healthcare industry doing to better engage with that patient support network? There's a number, like you were saying, Jared, we're still early in this process. We're still learning all of those mechanisms for engagement with the patient. But I think we really need to change a mindset and not make it about how do we teach the patients to better use our tools, but how do we build the tools to make it more intuitive for the patients to engage with.
We had Michelle Davey on here a few episodes ago, the CEO of Wheel. And she said something very similar. Either she's channeling you or you're channeling her energy. And she, what they're doing over at Wheel is more or less, to your point, like building products that connect into where patients are already at. And her example, if I don't want to misquote her, so apologize if she's listening, but was around emergency care. And so if patients are coming to the emergency room, and, I grew up in, administrator in hospitals, and in a sense, we hated when patients would come to the emergency room because it's like the worst place to get non-emergency care, right? But most people would show up, with cold, flu, sore throat in the emergency room. And so what Michelle was saying, I think you're saying the same thing, is like, hey, if people are coming to the emergency room or whatever channel they're accessing, let's build, the product or service that is maybe more appropriate, but at least connects through that channel where the fish are, so to speak, right? And so appreciate that thinking. I think it's actually very intuitive, but a lot of healthcare leaders I'm noticing don't think that way, right? They want to re-educate. How do we get folks to choose urgent care? How do we get folks to choose their primary care provider as their first pass at solving their issue, when really that's probably a fool's errand. We just need to meet them where they're at, to your point.
And it's the same thing on the provider side, right? In terms of physician behaviors, right? You don't want to have to, physicians have so much on their minds. I couldn't imagine having to deal with what they deal with on a day-to-day basis and keeping up to date on all the latest research and trends in the healthcare industry. And if you're just throwing something else at them that they need to learn, to your point, Zane, fool's errand. They're not going to do it. They're already burnt out. And, we're seeing early retirements. We're seeing folks not really wanting to go into this space. But how do you meet them where they are and make their lives easier? Something that, so obviously we've been interviewing dozens and dozens and dozens of care providers over the past couple of years. And one thing I've been hearing is EHR systems. they're getting so complicated and so difficult to use that the care providers themselves, like everyone says, oh, you need to integrate with our EHR. You need to integrate with our EHR. But then you talk to the nurses and the physicians that are using these EHRs and like, oh my God, if there's another screen I need to, or sub screen that I need to navigate to, I don't know how I'm going to manage this. And one of the nurses I was just talking to last week said, she's aging. And she said, as my glasses get thicker, some reason the font gets smaller and smaller because they try and cram more and more into these screens. It's like, how do we provide a solution that both integrates with their current workflows, integrates with their EHRs, but also provides them with an experience that's simpler and easier to read? Something as easy as just like an iPhone app that's easy to integrate with, that's easy to interact with and understand, and that's very intuitive. I don't have all the answers to that, but I think that's the mindset that we need to approach this from. And we're going through some growing pains in the industry right now.
One concept we've been trying to drive home on this podcast is educating our listeners that there are new skill sets and tools needed in healthcare. And what I would argue is likely some of these EMRs and frankly other more legacy healthcare technology, they never took like a design approach to how they built these pieces of software. And so they may not have like user interaction designers on staff or user interface designers. And you end up with interfaces that look like, dare I say, Epic, which are getting better, but they're nowhere near as intuitive as say, Google or how Apple would put something together or even Fitbit, right? I guess we should give Epic kudos. Like I said, I've been using Epic this week. Actually, I had to book some appointments and book my own appointments. It was actually decent, but again, still not to where you'd expect the level of intuitiveness as like an Apple product. And so I still think it's, to your point, it's something that the industry needs to upskill on and start to think about hiring those, in the same way that we would hire physicians to do surgery or clinicians. I think health systems need to be thoughtful about hiring designers who can apply their discipline across technology and across service to be as diligent as we would be, doing a transplant surgery, as we would be designing services and experiences that resonate with consumers. But that's just... To
that point, I was just talking, so the chief population health officer for one of the health systems we're working with right now, he told me I was meeting with them a week or two ago, and he said, if my patients want to order a pizza, they open an app, they can find a place, they can order it within a couple minutes.
Couple clicks.
Right? They can order a pizza in 20 minutes, that pizza's at their door. Why can't healthcare be the same way? Why can't it is like, help me figure this out. How do we deliver a similar experience to our patients? And I thought of that. I'm like, why can't getting access to healthcare be as easy as ordering a pizza? I don't know.
I think it's possible. And, Jared and I both kind of do this for a living in our day jobs. And we're certainly working with a number of provider systems to get there. But at the end of the day, it's just mindsets that you're jumping through. I find usually the data isn't structured correctly on the back end. So it makes it hard to enable that like a 1 or 2 click. And then frankly, there's a lot of more legacy minded healthcare leaders, first of all, can't vision what the future could look like. So there's a bit of a blinder on. And then there's also, I've noticed like a risk issue where a lot of these leaders feel like they're opening themselves up to risk by making the process simpler, right? As opposed to like having, 10 different buttons to click. Did you really want this? Do you really want this? Validate that, as opposed to making these transactional experiences simple. Curious before, I know we're getting to time here, but before we close out, we, I always like to ask a little bit too about like where we see the future of health going. And curious, as you all at LG and Primefocus think about where you're making investments, I would love to get your opinion on where you think like other, maybe call it like adjacent industries or service might be able to connect into the more formal health system. And so one perspective that we've had here at the Healthcare Wrap is that the future of digital health might, or I think it's starting to be, would be things like connected fitness. And so connecting, patients to actual fitness and health routines as opposed to always being focused on clinical care. And so curious as you all, it sounds like what you're doing really at Primefocus is connecting folks to devices and disparate streams of data?
We take a very holistic approach to this, and healthcare, managing a patient's health goes beyond just traditional healthcare delivery. It involves mental health, as you were saying, physical health and fitness, prevention, as I mentioned earlier, involving the community and their caretakers. I think you need, in order to truly affect the state of health and the mindset around how patients manage health, you need to address all these different points. And I think that's something that's been missing thus far in the industry. And that's part of what we're trying to do in terms of providing a holistic, unified, and simplified experience across a variety of different touch points that all can influence a patient's health and the environment and behaviors that that patient is exhibiting that might be unintentionally contributing to poor outcomes. And moving from that mindset of just sick care, let's just treat patients when they're sick, to let's treat the patient and change their mindset in terms of empowering them to have more control over their own outcomes. Instead of something's wrong with me, I need to go to a doctor to get this fixed. It's about empowering them with tools that allow them to take more control over the future of their own health. And that the only way we're going to get there is by taking a holistic approach.
Yeah, this has been really enlightening, Darren, because it's, again, one of our goals is just to help expand the vision of those working in this field and help them see what's possible. To Zane's point of that vision isn't always clear. And so it's helpful to have all that at our fingertips. And with that, that's a perfect place for us to wrap this episode. It's been an absolute pleasure to speak with Darren Sabo from Primefocus. I want to thank you again for joining us today. Appreciate you joining us.
Thanks, guys.